Hey Megan. All right, I'm going to show you how to do a safe massage. The massage I do for Chubby. First, you're going to start about an inch behind the halter, and you're going to press on their pole. And they should go down. If they don't go down, you can lift their chin and ask again, and that's just to help them to relax a little bit. She's really good at it. Then you're going to slide your thumb down to across from their eye, right at the axis, and you're going to put mild pressure for the count of 10, and then medium pressure, you see, for the count of 15, and then you're going to put heavy pressure. You don't want to hurt them. You just want to have pressure for the count of 20. And that is with your thumb, or you can use your forefinger, but your thumb is your best one. And then, yeah, you like that. You're going to slide up to right behind the ear and under the halter. And it's right behind the ear here. There's a pressure point. She's already releasing. And same thing, it's mild for 10, moderate. And you don't want to like push into them. You just want to be gentle. You want to take your thumb back out to 0 before you go to the next one. She loves this so much. Good girl. And that's heavier pressure, but I'm really not pushing. I'm just pressing gently. You know, you'll feel it's soft, so you'll feel it. Okay. Then you go down their top line and let them know that you're going to touch them all over. You're going to yawn already, yeah. And then you jostle their crest, so you'll feel like the crest of their neck. You put your thumb underneath that big ligament and you just jostle, and you do that 3 times. Don't do it too hard, just sort of medium. Yeah, she likes that. And then third time up, you go underneath, like so. You feel that big ligament, that big chunky part. You slide your thumb up, and it's the same thing. It's all these pressure points. And I'm going to take a picture of all the pressure points for you and send them to you. And it's the same thing. It's mild, moderate. You can see her, and then heavy. She's so used to massaging, she loves it. She hasn't had one in a while. Then you slide up. You'll feel it in your thumb where that next spot is. There's about 4 spots up. Sometimes they're a little funky about up here, and what you don't ever want to do is push on their spine, no matter where, on their back or on their throat. And then you do a little bit of cross fiber, so you just rub back and forth. Yeah, I know. And up. I know. And you'll feel your thumb will go way in, and they like, some horses will pull back. Nighthawk pulls back. She loves it. And then you rub that spot, and then one more up by the pole, but not the pole. You'll feel there's like an indentation. And then you rub. And then you give it a good rub all the way up on those spots that you did. And then you're going to take, this is called compression, and you're going to take the heel of your hand right about in the middle of their neck. You see? So this is their spine. So this is the splenius and the brachiocephalicus, and you're just going to go up and back down. You're going to do that 3 times. I know. And you can be progressively harder, but it just depends on what your horse can take. And then, Tia, there's no cookies. You're going to do the same thing. You're going to go up, find the same, it'll pretty much be in line with the spots that you worked on the way up, and you'll feel like she's got a pretty good knot right here, and you'll feel it. And they'll lick and chew. Sometimes they yawn. They definitely poop. And then you still want to do, she does this all the time, you want to do this back and forth motion after you've pressed. And make sure that you are above the spine. Look at her eyes. You do one side of the body and then the other. You don't go back and forth, back and forth. And then you close it off with a little bit of that compression. Okay, come here. Get up here. The next thing you're going to do is you're going to take your elbow and you're going to go up the between the neck and the shoulder, right here, and you're going to face his opposite hip, and you're just going to press into that shoulder, and you're going to go up and down, and then you're going to press in. And sometimes they get a little funky, sometimes they don't. If you can't do it with your elbow, you can just press. With the big horses and the little tiny horses, I have to just press because they're too big or too little for me to put my elbow. She's perfect size, but and then there's like 3 spots, and then you just rub it or use your elbow. Okay. Stop. The next thing you're going to do is you're going to take the wither and you're going to cup it like this, and you're going to do a little rocking back and forth of her wither, of his wither, and then you're going to do, this is called percussion, you're going to take the flat part of your fist and don't hit the bones, just use that trapezius and rhomboids are right here. So their scapula and then their spine, so in between. And you just do this gentle percussion, and then you do the compression again. And then you do this zigzag, which is like this, with your fingers. And then there's like 2 spots on their withers where you put pressure. You'll feel it. You'll just feel it in your hands. It's not a specific spot. It might be a different spot for a different horse, but you'll feel it. And you do the same thing. You do this light, moderate, and heavy pressure, and you really push in. They usually like this spot a lot. Sometimes they act like you're giving them a little shoulder scratch. And then when you're done, you do a little compression. Okay, then, come here, get up here. Good girl, you're a good girl. So then, this is their deltoid, and this is their tricep. You'll feel there's a groove. There's a groove in between. You can feel it with your thumb. So you're going to do the deltoid first. And then you're going to do the tricep, and it's just compression. You can use the back of your knuckles, well, the flat part. All right, and then you really give it a good up and down, and then you go up this groove. There's like a little arrow that points to it. Tia, could you leave your halter on? Could you not? And you go up the center of that groove, and you'll feel you'll feel where, you'll see, like you'll get a reaction. And a lot of times that's the reaction, where they're like, ow. She has shoulder issues, so, and then you go up that groove. There's 3 points, goes all the way up to here. And then you just close it off with this backhanded compression. Okay, come here, sweetheart. Come here. I know, you're not very great about this stuff. Okay. This is the serratus thoracis. This is where we sit, and it's always super reactive. So you need to step over. Go sideways. Go sideways. Thank you. Go sideways. Thank you. Good girl. Jojo. So it's behind the wither, and you're going to do this compression right about to the top of like where your hunt girth would go. And she's pretty good about it. Some horses are really reactive here, but I work on her a lot, so she's really good. And then you're going to go up and down and feel for pressure points. She's going to get her halter off before she's done with this. Okay, lift her off. And there's like a big lumpy spot here. It's definitely a spot. Tia, you're going to end up getting hurt. Now knock it off, because I'm going to hurt you. And then you do the same thing. You do that compression. It's like a little twisting motion. There's no cookies. And then behind the girth, this is behind the elbow, I'm sorry. You want to do this backhanded compression. And then you go up the groove with the flat of your fingers, like right into their back of their shoulder. And they usually like this. And there's like 3 spots. And then we close it off. Then the girth box, you do the same thing, and you run your hand across it. Sometimes there's some really bad lumps. You'll feel, she doesn't seem to have any, but a lot of horses do, and you find those little lumps and you give them the same kind of treatment. You know, the count for 10, count for 15, count for 20, and they either do one of 2 things. Like Adonis really tried to bite me. Some horses go to sleep. You know, sometimes they just really like it. And then you close it off the same way. Then you want to do the pectorals. So they get this like little slap on the chest, low, like where their little boobies are. And then you give them a little, like you're milking a cow. And then you'll find the groove, and you'll find a pressure point in the groove on each side, not in the middle, on the sides where the chest comes into the pectoral muscles. And you put that same kind of pressure. Good girl. And then same on the other side. And you do this from both sides. And then when you close it off, you do this little slap. Their anterior pectorals are here, and they get the same kind of slap. You want to work on the opposite one of the side you're on, because if your horse is kicky, they'll most likely kick with the opposite foot. Right now I'm not being very safe with the Tia. And then you put pressure on that spot underneath where the girth goes, and they like that a lot. And then you do that percussion to close it off. These muscles on the legs, you can just do this very kind compression, and then you make a pass down the big fat part of the muscle, down the groove, and a very light pass down the back of the groove. And then you do this just 3 times, and it feels good. Okay, when you're working on the back, and from here backwards, you want to put your hand on their thigh. Some horses will kick. It's just a reaction, and you can stop that kick. She's very good, but even she has tried to cow kick me a couple of times. So you just take the flat of your fist and put it there on their thigh. I hope you can see me. So now I'm going to work on her back. Here's her kidneys. Do not punch her kidneys. Here's her spine. come down about the length of your hand, and you do this nice gentle percussion, you know, with like a loose wrist. She has a short back. And then you do this back and forth. They either like it or they leave. She likes it. And then you take your fingers and you make these big circles all along that whole area. And then you do this zigzag thing where you go up and down and up and down. And then there's about 4 spots on their back where you do the direct pressure. You can do the direct pressure on their kidneys. You don't have to if you don't want to. And horses can be very reactive or not reactive at all. She used to be much more reactive. She used to get kind of emotional and pin her ears. She doesn't do that anymore. And you'll feel there's a tightness here because their obliques come up here, and this is where their SI is. So you'll feel it. She's resting now, which is good. And then after you do that pressure point, you put your hand flat on their kidneys, like the count of 20. And then you finish it off with this light compression. Okay, then you're going to do their ribs. So you work in a straight line down. That's good, she's releasing. And so you go below the back muscles into the rib cage. Try to get in between the bones. You never want to press on the bones. And they tend to like this. And you slide up after you've done your light, moderate, and heavy, and then you go down about 4 inches. She's falling asleep. And you push, and I still have my hand on her thigh, just for safety. And then right about to, you don't want to go down here, just right about to the bottom of the ribs. So she's doing a lot of releasing. That yawning, chewing, passing gas. So on her, there's like 3 spots on her main rib cage because she's an Arab. You'll probably find the same thing on Chubby, but then you do behind their rib cage too. That can elicit a reaction. So only go as much pressure as they can stand. You know, like she can stand quite a bit. I could probably press pretty hard. Adonis, I have to like use a feathers touch. So whatever he's telling you, trust him that he's telling you the truth. Like, you don't want to hurt him. You want him to like it, and you want him to have this kind of like, oh, I really like this. So then you can go behind the rib cage here and do the same thing. You're a good girl. These are getting into the obliques. She really likes this. Good girl. She'll let me go down to here. Careful on the flank. Just be careful. The Adonis won't let me do this. Then you can put your hand here. And then do the same thing right up the whorl. You know how their hair goes here? So bottom of the hip joint, you'll feel where it comes together. This can be a very sore spot on them. And so just use your judgment. She's definitely releasing. I hope you can see me. So yeah, I want you to step up because I don't know. Come on, get up here. Good girl. Okay, so So you can go, you know, you don't want to go under. You could get kicked. Tee up. And then you do their abdominals, and you just be very gentle, very respectful. You do this milking the cow thing, and then you'll find some tight spots on their abs, and you can do the pressure. Oh, she's farted. And then close it off with that nice percussion. Okay, point of hip. You'll put your hand, there's their hip. Put some heat there. I'm just going to angle this camera slightly so that I can be sure that you're seeing me. Good girl. So point of hip, yeah. And then you use this light compression, like right inside that bone. And then you put the pressure points. There's like 3 on the inside. Now, if Chubby's really reactive, don't be upset. Like, oh, and she's gonna cow kick. All my horses were. It's just Tia gets a lot of this. So, can you please step up? Come on, come on. Good girl. Good girl. So after you do these 3 points, you'll feel them. They're right on the inside, and you close it off with this compression. Hey. And then on the other side of the bone, not on the bone, on the other side, you're going to do that nice loose percussion. And then you're going to do your zigzags. And then you're going to put pressure on the pressure point on the opposite side of that bone. No, stay up. This spot can be tough. I hope Megan can see me. I want to do this twice. Get up. Get up. Step up. Good girl. You can put your horse on cross ties. I'm just trying to make her stand sideways so you can see. Yeah, this is it. I don't need you killing yourself on that. Come on. Just stand. Okay. All right. So after you do the 3 points of pressure, so you're going to 10, 15, 20, 10, 15, 20, 10, 15, 20. You're going to close it off with this percussion. And then you get to work on the glute. So you're going to be a few inches down from the spine. It's this massive muscle. Still keep your hand on their thigh, and you're going to do a ton of this percussion until you feel like, oh yeah, that's great. That's nice and loose. And then be sure that you're off the spine. You're going to do these zigzags along the butt. So the whole top of the butt to the point of hip, and it'll feel corded almost in some areas. And you're going to do that pressure. It's called direct pressure. I mean, it's really like poking. And you can switch hands, it doesn't matter. Ooh, like here's a spot. Hopefully you don't fall asleep with me doing this. And so you can do like up to like 4 lines of this. I'm just going to do a couple. As much as he'll tolerate. And you can see her back has already come up from me doing just this side so far. Oh. And there's a spot here. And when you close this off, you do the same thing. You do this heavy percussion. And then there's a spot on the tail, like a couple inches down from the spine on the tail head. You do the same thing. I just have to do this a little more. And you do the same thing. There's a spot here where you want to put direct pressure. And then you close it off. All right, then if you're brave, you can go inside their hind leg, just about the length of your hand, or up to your wrist. And this is their hamstrings, and they can be really cuckoo reactive or not at all. And you give it that nice little flat-handed, gentle slapping. Then you do that milk the cow thing. And then there's like 2 pressure points on the inside, and you just do this direct pressure coming towards you. They can get kicky. If you don't feel comfortable in doing that, don't do it. You don't need to get kicked. She's just really good. She really likes it. And then you close it off with that little gentle slapping. Okay. Then we have this last muscle and these before we do the hind leg. So you do this backhanded compression. So you like make a little fist, and you go up that groove. There's a groove back into the poverty line, and so you go up that a few times. You can do it pretty heavy, and then there's that groove. So you slide your thumb up the groove a few times, and then you put direct pressure on it. And in these little pressure points, you'll feel it. There's not a doubt in my mind that you won't feel it. And then you close it off with that same compression. This area can be really tricky. Like, I have a hard time working on Adonis. She's really good. So you can work all through this inside, all right? And you want to really... This allows their stifle to bend, and it's a really important muscle, and you want to really make it soft and squishy. When I do this to Adonis, he would like to put me through a wall. So then you can do there's like inside the bone, you'll find the pressure points. They tend to like it. Yeah, see, here we go. That's what they'll do. It's a total reaction. You just protect yourself with this. Come on, you have to go forward because Megan needs to see all the details of your pretty little bum. Stay. And then, no, stand. Stand. Stop. She's really enjoying this. I know. And then you close it off again. And then your last one is you just do that same thing on her back leg that you do on the front leg right here in this big muscle. Kind of strip it with your thumb very gently on the back. And then when you're done doing both sides, you take their tail very gently, and you want to do 3 sides each. You want to stretch them 3 times on each side. And they'll like lean into it. You'll feel it. Then after you do the whole massage, you need to walk them for 5 minutes because their muscles have actually had a workout. So you want to cool out their